You're welcome again. This is your friend, No Solution. We want to talk about the type of medications that have various effects on sexual function. And it is good for you to know, to be aware of this potential impact so that when you are going through such, you'll be able to, have rest of mind or peace of mind that there is nothing wrong with you after all. So there are medications that can affect sex life. They have various groups and various purposes. The number one on the list is antidepressant. If somebody is going through depression, there are some drugs like serotonin, all those things that doctor gives, they are prescribed and they can cause loss of libido, sexual dysfunction, they can give you delayed orgasm, they can cause priapism where the penis just remain erect with no respite. You understand? And of course, if you are able to, if you know, you understand, it makes it easier for you to, to have peace of mind, like I said, ab initio. Then we have some group of drugs we call antihypertensive or beta blockers. They also decrease libido, cause erectile dysfunction. We have some group of drugs that they call diuretics. They cause loss of function, loss of sexual function, and decrease your libido and give you erectile dysfunction where the penis cannot stand erect on its own after all effort. We have some group of drugs that call anti-anxiety medication like benzodiazepine, decrease libido, they cause erectile dysfunction and all that. Those are some of the things. And of course, we have the drugs that we call hormonal medication like the birth control pills. They also decrease libido. They cause vaginal dryness, make you to lose interest in sex. We have the hormonal replacement therapy. They cause decreased libido to have causes vaginal dryness for the female folks. Then, of course, we have the antipsychotics. Typical antipsychotics like they decrease libido, they cause erectile dysfunction, you understand? And most of the times you lose interest in sex and it can lead to erectile dysfunction as well. And when we're talking about these, there is another group of drug that we call steroid anabolic. Steroid. We have anabolic steroid, like it decreases libido, causes erectile dysfunction. And we have group of drugs that we call corticosteroid. They are still under the steroid group anyway. They cause erectile dysfunction, they cause loss of libido. You just lose interest in sex because you are on these medications. And we have a group of drugs we call opioid. It decreases your libido, can cause delay orgasm. You're just making love. You are not being able to, ejaculate or reach orgasm both in the female and the male. And effect of medication on sex varies. Decreased libido, medication that can decrease sex drive, making it challenging to initiate or maintain sexual activity. And I want you to know that one of the impact is erectile dysfunction. You understand? Medication, a lot of them can cause erectile dysfunction, and it will make it difficult for you to achieve or maintain an erection, especially in the male. But in the female, what will they do? They will cause you to have loss of libido, cause you to have vaginal dryness, delay orgasm. It makes it so difficult to reach orgasm. You are just there. There's no connection like the chemistry to make you have to reach orgasm. Then of course there's vaginal dryness. Like I said, some of this medication can cause vaginal dryness and make sexual intercourse uncomfortable or painful, especially to the female folks. You understand? Then it can lead to priapism. Priapism is a form of sexual problem that there is a prolonged and painful erection. The penis is just there, not going anywhere, not ready to go down, and it's really painful. Most of the time, you might need the intervention, surgical intervention. So, what do you do if it if your medications are affecting your sex life? Number one, you have to visit back to the doctor that prescribed those medications to let them know the effect or the potential effect of that medication, those medication on your sexual life. And of course, your doctor may be able to adjust your medication or recommend other alternative treatment. So that's the reason you should go back to the doctor to let them know that this is what you're going through. Then you should consider alternative therapies, you understand, such as counseling or sex therapy, which may help address sexual dysfunction altogether. You understand? Then, apart from that, you should maintain open communication. All these things you are going through, it is not only meant for you. Your partner has to know about it and work together so that you both be able to work together to find lasting solution to all this problem. I want you to know that it's essential to prioritize your sexual health and well-being. So therefore, don't hesitate to seek help if you are experiencing sexual dysfunction related to medications. You understand? So keep moving and see you in the next video.